Hey guys, I've got a common cold flu and cough. I decided to do a video. It's been a while. This is Abraham. You can subscribe to my YouTube channel as pharmacist Abraham. So I'm going to quickly talk about cold, common known as common cold. So what is common cold? Common cold is a viral infection caused primarily by a group of viruses called rhino viruses. These account 30 to 50% of the cases. It can be caused also by coronaviruses. So these viruses are transmitted basically via the respiratory tract through the inhalation. So through the inhalation of what we call respiratory droplet. Yes, so it's a viral infection, common cold. Yes, common cold. So in terms of pathophysiology, how it enters in the body and causes a disease. So after the virus have entered, they simply lead to inflammation of the nasal mucosa. So this is your nose, or this lining. Yes, and then this will increase what we call vascular permeability, and the high production of mucus. Yes. So what are the clinical signs? So clinical signs of common cold, or what is called nasal congestion. Feel like your nose is blocked, and then we have sore throat. You can have a sore throat, and then we have sneezing, mild fever, fatigue, and sometimes you can be coughing, and then you may also have what we call a running nose. So mucus just comes out of the nose. So how do we manage? So management of common cold. So management, basically, we don't give antiviral. So number one, there's rest, hydration. So drink a lot of water, maybe drinks like juice. Yes, they help. And then you can take analgesics. So these are pain relievers. pain relievers, such as those in Africa, we call it paracetamol or Panadol, or as in America we call this acetaminophen, or common as a Tylenol. So nasal decongestant, e.g. pseudoephedrine, so you can take also saline nasal decongestant. So that analgesic, you can take also ibuprofen. Yes, it helps even with the fever, with the pain. And then there's a warning actually from WHO. Don't use antibiotic. Do not use antibiotics. Antibiotics, they don't work unless the doctor confirms that there is a suspected super infection. So just use this. And then so flu, or called as in so flu. So what is flu? Flu is a viral infection again caused by influenza viruses. Basically caused by influenzas type A, B, and C. So type A is the most severe. Even people get vaccine for this, as in the US, a lot of vaccine for this, prevent this. Basically, we usually give Prevana 20 in the pharmacy to prevent that. So this spread, like common cold, spread through respiratory droplets, especially even when you touch contaminated surfaces and touch your nose, you can have this virus. Pathophysiology: infect respiratory epithelial cells, causing cell damage and inflammatory response. Similar result from cytokine release. So I'll talk about clinical presentation or symptoms. So clinical presentation, so you can have eye fever, chills, usually there's headache, malaise, meaning feel tired, like you're sick. Dry cough can occur. Sore throat, fatigue, sometimes sneezing. Yes. So how do you management of flu? So if it's severe, they can give antivirals such as oseltamivir or Zanavia. zanamivir. So we can give as well analgesics such as Brufen, acetaminophen or Panadol. So WHO plus CDC, Center for Disease Control, WHO recommend annual vaccination to prevent flu. You say people get vaccinated a lot for the high cases. So what is cough? Cough is just a symptom. So cough is just a symptom of something. So you can say cough is basically cough is a symptom of a respiratory tract, you can say problem or disease. You also cough can be caused by irritants, maybe can inhale chemicals, maybe allergies. Cough could be allergic reaction, and cough can be a sign of chronic diseases such as asthma, chronic obstructive pulmonary disease, COPD, pneumonias. Yeah, but today I want to talk just the cough, the seasonal. I would say seasonal cough. Yeah, so usually this is caused by allergens. Yes. And then how do you manage this? So if cough has underlying if cough is accompanied by underlying problems such as asthma, COPD, under COPD, we have bronchitis, we have emphysema, pneumonias, tuberculosis, TB. Treat this to manage the cough. But if it's due to allergen seasonal, so usually we give drugs called as antitussives. Commonly used is dextromethorphan, commonly found in cough syrups. Yes, dextromethorphan. You can also give expectorants such as guaifenesin or mucolytics. So antitussive, these are cough suppressants. These suppress the coughing center. Even honey, common honey, is a cough suppressant. Expectorants, they cause what you call expectoration. So you're able to cough. You're able to cough the mucus out. So mucolytic, this they cut the bonds holding the cough, making it easier to cough out. This what if cough has lasted, especially if cough has lasted after taking all this, you have to see a doctor. It could be there's a problem, especially TB. So especially if you have If you sweat at night, sweating at night, if you're loss of weight, so according to WHO, they say productive cough, whether you produce mucus or non-productive, for more than 2 weeks. It could be TB. So, and there are other problems. It could be even heart problems can cause cough. So I just wanted to talk about season cough. Season cough. Yeah. So always consult your pharmacist. Consult your pharmacist. Yes. Yes. So guys, subscribe to my channel, Pharmacist Abraham, and follow me on Facebook as the Abra Health and Business Hub. Thanks.